Our mission centers around improving the health and lives of the communities we serve. And as part of that, we've really opened up a multi-front strategy to combat diabesity, that dual epidemic of diabetes and obesity. And to address those, there are two tried and true methods. You can exercise more, live an active or healthier lifestyle, or you can eat healthier foods. And part of that is having access to foods, and that's what Garden on the Go looks to address. Garden on the Go is essentially a mobile grocery truck. About a dozen stops throughout the city. Runs Wednesday through Saturday, year-round. They stop for an hour to an hour and a half each location.
What I love is that when people come on the truck, they get a light in their eyes when they see how fresh and how tasty everything looks on the truck, and then their eyes light up again when they see how affordable everything is. We have designed the program to try and entice them to eat more healthy fruits and vegetables. We think an important part of the program is that we accept food stamp EBT benefits. For a lot of our customers, that's a primary source of how they spend their money to attain food. And so by accepting EBT, we're able to give them that opportunity to turn away from convenience store or convenience foods and then back to kind of healthy, whole produce.
In Indiana, the hospitals have been very active in the communities over the past few years especially to try to improve the health of the populations, not just focusing on what's happening within the walls of the hospital, but looking outside the hospital to engage other stakeholders and patients and families in ways that are going to improve their general health in order that they'd have improved outcomes while they're in the hospital. We know in Indiana, for example, that we're in the bottom quartile in certain measures like obesity rates and diabetes rates and smoking rates. And so hospitals, if they can do everything they can to improve those in their communities, then the complications are less when they come in for care.
It's so cool because a hospital network or a healthcare provider has chosen to focus on population health to decide that we've got to take care of our residents before they ever walk through the hospital doors.
There are lots of resources. There are lots of resources that come from the Indiana State Department of Health, for example, and make them available to hospitals so that they can target specific areas like obesity prevention and work with not only their own employees to craft benefit programs and make sure their cafeteria is serving nutritious foods, but also to work with other partners in their community so that they can work on walking trails or food programs, other kinds of things that would encourage the people within that community to eat healthier on a day-to-day basis.